Hi, this is Dr. Dan Ratner, and I'm here today again with Dr. David Schechter, but this time joined by Dr. Justin Barker. He is a psychologist who collaborates with David, who is an MD, on groups around mind-body process. So we're going to talk to them about how they came together and what that collaborative model looks like. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I'll get back to you personally. Guys, I really want to thank you both for being here. It's always such an honor when anybody comes on the podcast of the stature that you guys have. You are working with a lot of people and doing a lot of good. I hear through the grapevine all kinds of things. So, David, you've been on the show before. Thank you for your willingness to come back. But this time, we've got Justin with us. And Justin, I wanted to welcome you to Crushing Doubt, and I think we're going to start with you because, David, we talked previously, and for those watching now, if you didn't see the episode with David, it's really fantastic. He has so many great things to say, and I'm always I really value when each perspective comes on, each whether it's an MD or a psychologist, everybody gives different insights. But I will say, getting the insights of the MD is often really enlightening for me because it's just not my area of expertise. So Justin, you and I will have a lot in common, I think, about these things. So let me turn to you now. First of all, I know just a little bit about your kind of TMS mind-body story. You had 4 years of back pain, is that right?
That's right. And then I had a subsequent other mind-body issue that I can touch upon too. But yeah, back pain was the one that really got me going.
Okay, because I like to hear what brought people into this field. So let's start with you on that. Tell us a little bit about your story, David. I'm sure you know it, but you'll sit tight, and then we'll get to the collaboration you guys have developed. So tell us about your story. How did it develop originally, and how did it all go for you?
Yeah, so I started having back pain, and it's interesting because when I look back on it, I also can think of even earlier experiences that in retrospect were also TMS, but I would say the back pain was the one that was most clear and obvious. So I had lower back pain. I also had diffuse upper back pain. I would have a lot of burning in my shoulder blades. I would have shooting pain down my leg. And I started going to medical doctors and started doing physical therapy, and physical therapy wasn't really working. I was in, previous to that, good health, and I started to develop this pain narrative where for me, I have very hypermobile joints and ligaments. And the reason that I know that is because I ruptured a tendon and tore 4 ligaments in my wrist when I was younger. And the surgeon said that a quote unquote normal person would have broken the bone in their wrist. But because I'm so flexible, like I can do this with my fingers,
Oh, wow.
he said that I ended up tearing things instead, which was much worse. So I developed this narrative that I hurt my back because I was deadlifting and my back was hyperextended, and you shouldn't hyperextend your back while deadlifting, so forth and so on. And the anxiety grew, and it got to a point where every step I took, my left leg would hurt because extending my left leg was painful. So I was doing all this physical therapy. I wasn't really getting anywhere. And I also had this experience of the exercises starting to feel more and more absurd. So the one that I oftentimes share is kind of the breaking point for me was the physical therapist had a blood pressure cuff under my lower back and was saying that I needed to develop these hyper-specific stabilizing muscles, and that I therefore needed to do like a micro abdominal crunch so that I was getting my abs to generate a certain amount of pressure that I would look at on the blood pressure reader cuff. And that was somehow going to help me. And it struck me at that point, like, this can't be the way. So I had a number of people recommend Sarno to me, probably because at the time they could see that I had a TMS personality, even though I couldn't. And it was one of those things where it was like seeds getting planted. And finally, enough seeds got planted, plus I just was having no success using traditional medical approaches that I picked up healing back pain. I was in my own individual therapy, but it wasn't a TMS therapy. And within a couple of months, I got better. So for me, I had the book cure more or less the first go around. And then I can talk a little bit about another TMS experience I had that was very much not the book cure, but that was my back pain experience. And I think for me, when I look back at my back pain, the thing that sticks out is it was just totally miserable. It was all consuming. It was miserable. It occupied a tremendous amount of my mental energy. And then it felt miraculous when one day I woke up and I was just not in pain anymore.
Yeah. I mean, and that this is certainly mirroring my story. David, I'm sure that you've heard hundreds and hundreds, if not thousands of stories that are very similar to this. And I do want to hear about that other symptom, but I'm going to dive back on that first because I want to bring David into this interview. I don't want you just sitting there on the side. Let's talk a little bit about how you two met. So this is fast forwarding because Justin, you probably, I don't know, maybe you had years in private practice after that. How did you guys come together?
I'm going to let Justin start off that and then I'll finish the story.
All right.
Yeah. So I knew about Dr. Schechter because I was in Los Angeles, and then I'd also reached out to him to consult with another symptom I was having because I was having dry eyes, and I already knew all about TMS, but I wanted to just hear what he thought. So we met then, and my dry eyes subsequently resolved down the road. And then I reached back out and said, hey, I want to do more of this work. I'd written my dissertation on a TMS case study as well. So I reached out and we got to know each other and talk more about TMS, and things kind of went from there.
Yeah, I mean, so Dan, this is how some of my collaborations have developed. I've been practicing TMS work in Los Angeles for over 25 years. And, initially I reached out to the first psychotherapist that I worked with. His name was Don Dubin. He subsequently worked with me for a long time. He's retired now, but I've just made these connections in different ways with psychotherapists, psychologists. And, when Justin reached out, he seemed to have a lot of interest, background, and enthusiasm in the area. So, getting together to have a lunch and talk a little bit more about the work. And, I just sensed that we would collaborate well together, and that he had the knowledge, the interest, the background, the willingness to work, collaboratively with a physician. And that's kind of what I'm looking for. I different therapists do therapy a little bit differently. And I've learned that you have to let people do their thing, let them go with it. But having that common language that you have, that Justin has, that I have to speak about the TMS or the psychophysiologic disorder really captures the patient's attention. In a psychological sense, helps to prevent them from throwing up their defenses in a sense, because they're hearing the same thing from multiple people. And in my experience, it's worked the most effectively to work not just with a general therapist, but with someone who's got this background and experience. Beyond that, when we started to talk, I had mentioned to him, that I've done groups in the past, and lo and behold, somehow the pandemic came about some months later, or I don't know exactly how many, 6 months or whatever it was. And I got the idea along the way, maybe the Zoom thing actually could be a boon in one way for getting people together, because in Los Angeles, and I'm sure this is true in other cities that have traffic, it's very hard to get people, a group, into the same place at the same time, and to find a time that works for the professionals and works for the group. And when I've tried it in the past, it's always broken down because I can't get there by 6, or can you do it a different day, or that type of thing. And the Zoom, as we're talking, 3 of us today, you can see you can add another 5, 6 people to it, and you've got a group, right? So it's really a boon to that. And so we decided sometime in the fall of last year to begin the group. And we're about 6 months. We're in the 6th month now. We haven't missed a session. Tuesdays at 6 p.m. is our Pacific is our time. we can talk a little bit more about the group in a minute, but that's how kind of the collaboration developed.
So I just want to highlight for my viewers and listeners, and just for yours as well, how it's kind of moving to me that an MD and a psychologist can come together and work together on this, because it's such an important part of the work. It goes all the way back to Sarno, of course. He in working with Arlene Feinblatt, and then eventually Eric Sherman, Fran Anderson, and all these other people. Mm-hmm. I think that one of the things that we're dealing with in the mind-body process is we really are dealing with the cracks in between medicine and psychology. Mm-hmm. And for me, I needed to know that Sarno was an MD to take it seriously, even as a psychologist. I was like, this is the realm of doctors. But I think what we're finding is it's the realm of both. And linking up, I think, is such a great idea. So I really applaud the two of you for doing it. It sounds like you're doing great work. And I wondered if you could talk more about how you, when you did come together, how did you craft what you were going to do together?
I think first it's good to just acknowledge that David is a very special medical doctor. So I think one challenge that can exist between psychologists and medical doctors that I've certainly seen in the past can be, there can be a lot of like power dynamics, and also it can feel sometimes, depending on the institution or people, like it's a very unequal relationship. And something that I felt so strongly from Dr. Schechter from the beginning was a lot of kindness, genuine curiosity, interest, which I think are also some of his magic ingredients in working with TMS patients as well. So I think that made it very easy for me then to feel like I could really bring in the psychological understandings and insights that I had into our work together in a way that I think sometimes medical doctors and psychologists can have plenty of ego as well, but sometimes I've seen it where it's much more one-sided. So I think that, to me, was one of the key ingredients of having a really wonderful collaboration. From there, I think we did a lot of back and forth brainstorming, talking about what would work and what wouldn't work, and then also really trying and testing things out in a way that we're constantly refining what we're doing together. So those are a few things that stick out to me. Dr. Schechter, I'll turn it over to you.
Look, I think communication is very important. I mean, some of it occurs on email when we email one another about patients that have been referred. Some of it occurs on the telephone. Some of it occurs before or after our video groups that we do. Look, people with these disorders can improve in a number of different ways. Justin himself mentioned a book cure, and that's not so uncommon. Sarno described hundreds or thousands of patients who wrote him letters saying they got better just from reading his book. And, I've had some of the same experiences myself from people who've read my book and gotten better. Other people just need a medical diagnosis, just need to be told there's nothing seriously wrong. Your MRI is negative. Go on with your business. It's TMS. And then that's all they need. Other people find their way directly to a psychotherapist or a psychologist, and that work seems to be sufficient to get them better. But in my experience, and again, as you mentioned, I was trained by Sarno. I worked with him. And so therefore, the model that he was comfortable with Arlene Feinblatt and Fran Anderson, Eric Sherman, was very familiar to me. And so I'm not looking to be the guy that does it by himself all the time. I mean, I don't have to be the hero all the time. I can share the hero role or the professional role with other people. It's still gratifying to me when people get better. So over the years, I've been fortunate to have relationships with at least a dozen excellent psychologists and psychotherapists in the LA area. And many of those relationships continue to this day. Some of them got quite busy from referrals from me and from the websites and other things that they're listed on. So running into someone who wanted to do more of the work, now he's gotten quite busy too, but was appealing because I needed more referrals. I get quite a lot of TMS patients, and during the pandemic, with the ability to do telemedicine in many more states than I was ever allowed to, and actually in 43 states during this emergency period, the more and more patients were coming into my practice, and I knew that they needed more help at times than I could provide in the psychological space. So that's what, that's the basis for the communication, the collaboration. And if you want to help people, if you want to help patients, you find a way to do that. And sometimes it's by yourself. Sometimes it's by yourself with educational materials, books. I tell people every week, watch Crushing Doubt, watch his podcast. Dan Ratner has a lot to say about doubt. And we talk, it's one of my references to patients. It's on my resource guide. So I'm looking for lots of ways to help people. And when we started to put together this group and realized that there was an interest among the patients that I had and that Justin had to come to the group, we didn't know if it would last. You don't know if you get a group going. Maybe we had 6 people the first time or 7. We didn't know if it would continue. And it has become quite successful. I mean, last night we had 9 people, and we try to keep it below 10 because we feel like it's a more effective process and people can contribute more if we keep it around 8 or 9 people. I mean, we're not doing it to make millions of dollars. We could have 20 people in the room and they wouldn't be getting quite as much out of it. We keep it down to a reasonable number that pays for our time and efforts, but at the same time, people get a lot out of it. And we've been tinkering with the method. It's a 90-minute session. I first noticed when I started doing them, because obviously I'm a physician, I don't really do groups on a regular basis. I wasn't trained to do groups like you guys are, but I noticed the time went very fast. It was surprising. You start doing it and 20 minutes in, and suddenly it's 40 minutes in, and before you know it, it's 10 minutes to go. So it's kind of, when you really get into these groups, they move along quite quickly. But we figured out a way to do it, and I credit Dr. Barker for contributing ideas from his experience on how to structure it. And then we've gradually just added little things to be helpful. Last night I talked a little bit about affirmations, and lo and behold, doubt came up. We break into small groups. We do a little breakout session. And a number of the patients in my group, not so much Justin's group, but my group, said, I would do the affirmations, but I feel like I'm being inauthentic. I don't believe them because I doubt. I
Right.
said, well, you have to get back to the doubt. Let's talk about the doubt, because that's the root cause of why you're struggling to get better. And you certainly know that, Dan, because that's your major state message that you're making.
I do very, very well, and I'm glad to hear that the message is getting out there. And I want to thank you both for being part of that. To trust me as a resource and see that there's value in that is wonderful. But you are hitting the nail on the head. If we say things to ourselves, but we don't believe them, it really doesn't do anything. And we know this. So it sounds like people are getting all kinds of great things, including, references to doubt, but just across the board, you guys are giving a lot of great information. I wondered if you could give a little insight into how you ended up structuring the groups. I know you're tinkering with them, making changes. What are they like? What's the setup?
We usually start with a check-in. We have different questions that we'll ask, but we want everyone to feel immediately engaged. I think one thing that we've learned in the group, certainly that I've learned in the group, is it can be really lonely trying to heal from TMS. It's still not mainstream or popular, and people can have family members and friends and social connections that have a lot of pushback to a psychophysiologic explanation for pain. So I think having the check-in is a time for everyone get to share what they're actually working on, what are coming up as challenges, what are barriers to healing, what are successes that are happening. And that can be incredibly useful, both because people get to share their own story and also because there's a lot of commonalities that come up. And without a group like this, people can listen to podcasts, and there are, of course, a lot of other resources, but I think it can feel more lonely. So we start with a sort of check-in. Then there's a lot of lively discussion. People want to help each other. It's an incredibly supportive bunch. And I think in general, type T personalities, with the goodism, tend to be very nice. So it feels like a very warm, supportive environment. There's wonderful questions that come up. Sometimes those are more medical, and in that case, of course, David's going to take the reins. Sometimes they're more psychological, and I might respond. And then we try to also have some type of mini lesson each day that we think can be broadly applicable towards healing. So for instance, last night it was focusing on affirmations. We've talked about guilt. We've talked about forgiveness, goodism, perfectionism, self-criticism, a lot of isms. And then we try to break the group out even further into small groups so that people can really dive in further and then come back together. And like David said, it's a very fast 90 minutes. But I think a really critical element of the group is hopefully both we're able to impart some good wisdom or information or knowledge, and also the people in the group are very smart and very resourceful. And I think literally every group we've done, someone has suggested a new resource that we haven't heard of yet. So there's a tremendous amount of community learning that can occur, as well as I think the support of feeling like, wow, I'm not alone on this journey towards healing from a mind-body issue.
You know, Dan, about a month ago, we did a mini focus group. We said to people at the end of a group of about 8 patients, we said, who would like to stay for 5 or 10 minutes afterwards? We want to ask you a couple questions about the group. I think about 5 people stayed. And the thing that they commented on that they thought was the most important part of the group was the benefit of interacting with other people with TMS, just like Justin said, because you don't interact with those people in your ordinary life in general, unless somebody referred, the book or one of the doctors to you. And so they liked the idea of knowing they weren't alone and that other people had similar symptoms or different symptoms. And so that was the number one thing that came out of the focus group. And otherwise, they liked all the different elements, but having the opportunity to interact with other people with the condition. And again, we called it from the beginning a healing group rather than a support group, because my personal experience with support groups across the country with different conditions is sometimes they deteriorate into people kind of complaining and moaning and groaning with each other without maybe the right information or knowledge. Because you have both an MD and a PsyD, a PhD in psychology, running the group together, they're getting the right answers and facts and information in response to their questions and things like that. And we also guide them so it doesn't just become moaning, it becomes, what are the barriers? And then what are the techniques you can use this week to get better? What goals are you going to set for the next week? We try to make accountability one of the elements of the group.
It sounds like there's such a great balance between, and I think this is very important, there's a balance between getting them the right information and the collectivism that does combat that loneliness. I have many segments planned on this podcast, but one of them is, the feeling of how to get better in a society that says things totally different. And it is a lonely thing. So I think that connectedness is great. But then, I also like that you guys provide some scaffolding, because I think sometimes these things get too diffuse and then it's just a bunch of talking. And one of the things that I've tried to do in my work, and the reason that I have this 3-column structure, is I needed to organize it for myself. When I was trying to get better, there were so many different voices, so many different aspects, and all of them were saying good things. But sometimes they ran counter to each other. And actually that brings me to my next question for you guys is, do the two of you have differing ideas about how the mind-body process works, or do you tend to really dovetail together very well in that way? And if there are areas where you differ, how do you negotiate that? David, we can start with you, since we've been starting with Justin.
I haven't found incredibly major areas of disagreement. I think there are things that he can flesh out in the psychological sphere and go deeper than I'm capable of. And there's things that I can answer in the medical or neuroscience area that perhaps that he can't go into as much detail on. But we haven't really clashed very much in terms of theories or opinions. I don't know if we're suppressing things or whatever.
No.
It just seems like it's a good fit. We've both been individuals who've had TMS ourselves. We've both recovered from it. We've both been influenced by some of the same East Coast. Justin did some training in the East Coast at Rutgers for graduate school. So indirectly, or however, some of the Sarno some of the original Sarno psychologists, I think, taught the people that taught him. And I think that may have contributed to a commonality. But I don't think it's bad if a patient hears a slightly different explanation from the two of us. I don't think that's a bad thing. It's just that we are, authentically speaking to a truth at the core of all of this in terms of what people need to understand and what people need to do.
I actually think that a lot of times we're saying very similar things. A lot of the people in the mind-body community, there is a lot more overlap in what we think, and I do think there's a benefit to them, to the sufferers out there, hearing different versions of it, because one version is going to click for them better than another, or sometimes the fact that there are these multiple versions all converge in a way that makes it really fit. So actually, let me ask the question in a different way, because I realized that ended up focusing more on the possibility of disagreement. What I'm more thinking about, that maybe is most important for the viewers and listeners out there, is they are experiencing in a way, they're experiencing way too much information, and then also not enough. But I'm thinking with talking to you guys, I'm thinking more on the way too much information side of things, because I have a video on the contradictions that people hear about in the mind-body field, and some of it's because we do have different ways of saying the same thing, or I wonder how you manage that in the group, whether it's from the people you're hearing from, or if it's, in the way that each of you work. How do we bridge the gap for the sufferers out there to I don't know, get a more centralized and understandable way of thinking about it? Go ahead, Justin.
So I think this is a phenomenal question and a really thoughtful point, because in the group and individually too, there was a person who I thought said it well, that he was looking for an air traffic controller healing from TMS. And I think that really captured something that we all have experienced. I really love the idea, this to me is not just for TMS, but therapy and healing in general, that different ideas have resonance for different people. And so I think that the group in a way could be confusing because different people have different ideas, but I think it also does a really good job of highlighting that what works for one person won't work for the other person, or just won't have a deep resonance, and that's actually totally okay. The key is finding what does have a real compelling sense to the person. So, if someone, like, I think, Dan, that your idea of doubt is great. I found out the hard way that if someone has too much doubt, it can really negatively impact results when I did my dissertation. So to me, your idea of doubt has a lot of resonance. If someone else said, no, it's all about forgiveness for me. Cool. Like, that's great. And I think the group is a way, hopefully, where people get exposed to new ideas that resonate, and then also maybe even helps them clarify by going, that doesn't really work for me. Like, I'm not really interested in whatever concept, so that they can refine their own roadmap to healing. So I think something that David and I pretty regularly point out is there's lots of different pathways to healing. And my sense is that the key is not finding the right path as much as finding the right path for the individual, because I think where people get in trouble is they don't actually feel very moved by the path that they're on, but they're not sure what to do about that. And then they start blaming themselves and thinking it must be I'm doing something wrong.
Right.
Whereas I think sometimes the actual issue is there may just be a slightly different path that's going to work better for that person.
Yeah, and a corollary to that, Dan, would be the issue of overload. When I started in this field, all there was Sarno's lectures. He hadn't even written his first book, which I actually helped him edit. And suddenly there were books, right? And then there was my workbook some 20 years ago, the journaling workbook. And now there are a dozen books, and there are a dozen podcasts, and there are many videos. And so it can be almost overwhelming. So one of the things we've talked to patients with in my office and certainly in the group is to cull it down to a limited number of things, maybe go more for depth than for breadth. You don't get better just by chasing the next book or chasing the next video, but by really reflecting upon what you've learned so far. And so I think that's another element of this.
I think those are such great points, guys. And I really agree. And I've been kind of pushing this idea more and more recently that really to get better, each person has to engage with whatever works out there, whatever resources are out there, and they do have to fit it to them. This is one of the reasons there are all these contradictions, because we're working with all of these different minds. And what I like to do is say, well, maybe we can provide a general framework of ways to understand things or different ways of thinking that might apply. So I have a list of action steps that you can take. And these are action steps mostly of the mind. It's an action step of the mind. But at least half of them aren't going to apply to any given person. Probably more. So I think it is more about we put ideas on the table that all do fit together. And I encourage people, use my system as a framework, but really you're going to develop your system. And it sounds like that's a big part of how you guys are thinking about things in the groups or just in the work that you do, which I think it's a wonderful thing. And actually I was going to ask what you see to be the most crucial element of getting better. I know the collective group experience is one of those things, but I wonder if you two can speak to how about these individual differences? How do we help people figure out what is working for them? And what I'll just say one last thing on it before I actually let you answer the question, which is that I think a lot of times, I think you were saying this, Justin, that people criticize themselves if they're seeing some people get better when they're not. And I like to encourage people, no, there's only one right way to do this, and it's your way. Don't compare yourself to how somebody else is doing it, because you can't do it that way. You've got your own mind. So I wondered, is that crucial in your groups? David, we'll start with you.
Well, what's crucial is, as you say, to cut it down to the key elements for people. So I was taught by Dr. Sarno years ago, focus on accepting the diagnosis, which is getting people to work through, in a sense, the doubts and struggles they have, and to get them to think psychologically, not structurally or physically. So I incorporate that into sort of my three key principles, which is number one, attitude, belief, diagnosis. That's what you have to really work on. Number two, psychology, introspection, self-talk, journaling, therapy, figuring out how to think differently about your stress and about your life. And the third thing for many people is physical activity as well, returning to activity and dealing with the fears about activity, especially if you're dealing with a pain syndrome. There's other manifestations of psychophysiologic disorders and stuff. But so getting it down to the key principles, re-emphasizing those principles, but absolutely the healing journey is unique for each person, and that the doctor and psychologist are guides along that journey, as you said, of creating a structure or helping them to avoid getting off the road, but they have to find the road, they have to work through it. And it's really giving them a little bit of that space. What we found in the group is because we're seeing them every week, or at least I'm seeing them every week, psychologists often do that as well. You're just kind of able to catch up with things more frequently, maybe keep pushing them in the right direction. Right. Justin, you have thoughts on that question?
Yeah, I think it's another great question. To me, there's a few ingredients that I think with lots of different individual differences still apply. So one of those to me is 100% commitment, which I think also gets back to doubt. So I try to help people think about what 100% commitment has looked like, because I think most people have an experience in their life where they were 100% committed, and oftentimes can realize that they're 80 to 95% committed, but I think for true healing to occur, it's got to be near 100%. And certainly working towards that. The other one is that if people don't get better quickly, like some people will get better quickly and I think can heal from knowledge and more of an intellectual shift. But if someone's not in that camp, I do think that emotional experiencing becomes really critical towards healing, because what I see, and I think this comes through in the group too, is that people who can not just think about their feelings, but really access and experience them tend to get better. Whereas people who really struggle to feel the feelings, I think can still get better, but it can take time and scaffolding to help them to feel them in a way that doesn't become overly challenging or problematic or dysregulating.
Such great points. And I guess what I was thinking is, in terms of overload, whether people are coming to see you guys or me or somebody else, there's lots of good information out there. And I think the thing that we need to think about is how, like you said, David, we've got to help people limit it, because there's just so much. I mean, I had to organize my own system partly because of that. I just was like, there's too much. I have to sort this out. But I think in addition to that, we've got to help people know how they can choose their own path and ask the questions that they need to ask. To me, one of the key change agents is questions. Everybody comes to me looking for answers, and I tell them, actually, what we need are the questions. And here's why. Because the specific person has specific questions, and I can't help them if we're not addressing their questions. I could say all the greatest things in the world, but if it doesn't address their questions, it doesn't really get a whole lot done. And I think that the collaboration you guys are doing not only provides the safety to ask those questions and to be able to be themselves, but it also is providing these two very different but also very similar perspectives that come together. And so you guys are clearly doing great work, and I'm grateful to you for being out there with me on this. And I'd love to have you both on again sometime soon. Justin, it was a pleasure meeting you and hearing about your story, and we'll keep collaborating too. You know, this field in general, we got to keep coming together. I think that's one of the driving messages that I have. Instead of being in these silos, we've got to compare notes. We've got to work together here. And so I'm very appreciative of you guys, because we've already been doing that some, and we'll keep it up. So thanks for coming on, guys.
Thanks, Dan.
I'm always grateful when people come on to Crushing Doubt in general, but I do think that each time we get to highlight a certain thing that's different. And this time I was really, really pleased to highlight a collaboration between an MD and a psychologist. And you can see how they work so well together. And Justin made a reference to David's welcoming nature to him, which is really important. I will say this, from the MD side, being able to let in the psychologist aspect and let them do their thing and have their input. David is a rare doctor in that way, but Justin clearly does a great job of bringing in his perspective and hearing David's. I mean, the two of them collaborate very well, and collaboration's not always so easy, so kudos to them. But a couple of things that I just wanted to highlight that jumped out at me from this interview. One, we do have a lot in common. All of the different people who are saying different things. And so there can be a lot of confusion because you're hearing so many voices. But if we can hone it down to the essence of what people are saying, a lot of times they're saying very similar things. At the same time, you have your own individual mind, and you're going to need to build your own structure around what it takes to get better. So you take the best of certain things and you bring it into your system. At other times, you're really going to need to start tuning some things out. There's just too many voices. Try to think about it this way, and this is something both David and Justin and myself made reference to. Once you have things that work for you, you're done. You don't need to move beyond that. And if something's not working, then you ask questions and find ways to find new answers. So you're gathering your information to make this the process you need it to be. In any case, I had such a blast interviewing the two of them, and we'll have them on again soon. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I'll get back to you personally.